Some early statistics coming out of Bonheur are showing just how much some Mid-South families are struggling due to the pandemic. The numbers are part of the growing concerns about the long-term impacts that COVID could have on their children. Here's Local 24 News reporter Jalen Sochak.
Medical experts at Bonheur are very concerned about the numbers they're beginning to see and what those lasting impacts could be on children. Now, they're saying that the incidence of mental health issues like depression and even experiencing community violence are on the rise.
Yeah, so we're starting to see for the last 3 or 4 months now, parents reporting a lot of the stressors that the pandemic is putting on both them and their children.
Dr. Jason Yod reports the recent toll on the mental health of parents and then exposure to community violence has increased as high as 300%, putting children at risk of an adverse childhood experience or ACE.
Stress that children experience early on in life, that because of the degree or types of stress become toxic and affect certain parts of the brain and the functioning to impact long-term behavior and health outcomes.
The CDC defines an ACE as a traumatic experience that can happen through neglect, experiencing or witnessing violence, or an unstable home environment. During checkups, families are asked these questions for the Family Resilience Initiative, a clinic at Bonheur that supports the families of children that have had multiple ACEs.
The increase in the violence exposure and the increase in the mental health issues, I think it just brings home the stress of the pandemic. We have families who are worried for their own health, the health of their parents, the health of their children, of course, their financial health.
Dr. Yan says parental stress trickles down to children. It can also make them more at risk of experiencing neglect or abuse that can lead to lifetime implications.
As the number of adverse childhood experiences increases for a child, the higher the likelihood that they are to have potential behavioral and mental health problems, future problems with things like substance abuse, and future health outcomes.
For children that do experience multiple of those traumatic events, the Family Resilience Initiative does provide wraparound services aimed at improving life at home. That includes helping with food insecurity or providing resources in the event of a domestic violence incident. Jalen Sochak, Local 24 News.